Hello everyone. Today we are going to study the mandible. The mandible is the largest bone of the facial skeleton and it is also the largest bone of the skull. And before we actually go into the mandible separately, let us take a look at the mandible along with the skull. Now this is a frontal view of the skull with the mandible, and you can see the mandible actually forms the lower jaw, and it is quite a large bone with a U-shaped body and a vertical ramus on each side. And although it is a single bone, it does have a right half and a left half, and it has a body and a ramus, and the body of the mandible bears the alveolar process for the alveolar sockets for the teeth of the lower jaw. And you will come across the mandible in the dissection of the face and also in the dissection of the submandibular region and in the dissection of the triangles of the neck, that is the digastric triangle here, the submental triangles on the two sides, and so forth. And on the inside of the ramus over here, on this side as well as on this side, you have the margins of the boundaries of the infratemporal fossa. So the mandible does form a part of many dissection items. Not only that, the condyles of the mandible on the two sides, they form the temporomandibular joint, and the mandible also provides attachment to the muscles of mastication. The mandible gives attachment to a large number of muscles. It is related to quite a large number of arteries, veins, nerves, lymphatics, ligaments, and other miscellaneous structures. Now if we look at this lateral view of the skull, again you can see half of the mandible. We will actually study the mandible by halves. It is more convenient to study a half of a mandible at a time. And again you can see a part of the body of the mandible and one ramus of the mandible, and you can see the mandibular notch over here, and here you have the condylar process. In front you have the coronoid process, and you have half of the alveolar process or half of the alveolar arch, the lower jaw, bearing about 8 teeth. And over here you have the temporal region, and deep to the ramus of the mandible you have the infratemporal region, and over here you again have the temporomandibular joint. And this part over here, this acute border, this acute angle, not just an acute angle, it's actually more than a right angle between the lower border of the body and the posterior border of the ramus. Over here you have what is called the angle of the mandible. And if we look at an inferior view of the skull, you cannot see the mandible here because the mandible is removed, but you can still make out the socket for the temporomandibular joint. This is the mandibular fossa on the squamous part of the temporal bone. And now if we look at the entire mandible, you can see that this is the body of the mandible, ramus of the mandible, condylar process and coronoid process. And you can make out this hole in front of the body, that is the mental foramen, and this hole on the inside of the ramus, the mandibular foramen. So here is the view of the whole mandible, and we will subsequently be detailing and basing our studies on more or less half of the mandible because it is so very convenient. Thank you.